trying to buy food with the little income that I had. It's not what it's cracked up to be. When you have $400 a month to live on, buy your food and everything, you know damn well I'm not buying T-bone steaks. That's for sure. But I don't complain to nobody. Nobody knows what I go through because I don't tell them. I don't want my family to poor mouth me. And I tell them, I said, I'm on my own. I've worked hard all my life since I've been 13 years old. It seems so funny for me to have people waiting on me when I always waited on people, you know. It sure makes a big difference, really. And I appreciate it, but I never thought the day would come when I had to depend on somebody else.
In my position, I interact with more than 157,000 older adults in one way or another. We find that the issue of senior hunger is a growing problem for Northwestern Ohio. It is also a growing problem throughout the United States. In a recent study that was conducted, we found that more than half of the senior citizens suffer at one time or another from either food insecurity issues or direct hunger issues. But we do believe that if we bring together the healthcare community, the faith-based community, those individuals who are already working on food insecurity and hunger issues, along with members from the Area Office on Aging, that we can find some solutions that make sense.
As pastor, we try to provide ministries for the church and for the community. One of our primary ministries is ministry to the seniors in our community. In fact, we have built a senior building on the premises of the church, and we provide senior services to the seniors in our community. It's divided up into 3 entities. Senior Independents operate a senior daycare. The Choice Center operates a senior center, and the Mercy Health Partners operate educational component. And so we feel this is our way of meeting the needs of seniors in our community. But in addition to that, the church itself serves meals to seniors every Thursday.
Oftentimes, the seniors aren't going to tell you themselves. So you have to find workarounds and ways in which to gain their confidence and begin to address the issues slowly.
The best advice I could give families and friends and church members, anyone that visits the elderly or watches over the elderly, is to be observant. Look in their cupboards, look in their refrigerators. That gives you a sense of what their supply is in terms of food. And you can do that in subtle ways. Just while you're talking, just while you're having a conversation with them, if you're in the kitchen, say, come on, let's go in the kitchen and just let's have a cup of coffee or some tea or something like that. And while you're doing that, just observe. Ask them, hey, I'm going grocery shopping. You want to go grocery shopping with me? Or if they aren't as able to get out, then ask them, you know, would you like me to go grocery shopping for you? Or just surprise them. You know, I was out grocery shopping and I just felt so good. I bought all this extra stuff. Here's some things. I know you needed some items, so here's some things that I know you use all the time. So there's real subtle ways that you can go about helping the senior to get supplies of food and other items that they may need, because they're very proud people, so they don't want to feel as though you're doing it out of pity.
Because if we can keep seniors healthy and give them the nutrition that they need, it prevents early institutionalization, either through a hospital or a nursing home. So it makes sense for us to come together as a community and help explore how do we identify the problem, who has the problem, and what are some of the common solutions to address these issues. It's not about throwing more money at the problem. It's about the community coming together, finding solutions to senior hunger.